Hi, my name is Ashley Cowart from the Denver Cohort, and I'm submitting my upper extremity, lower extremity, and neuromuscular validation for health assessment. I would knock, enter the room, wash my hands, provide privacy. Hi, my name is Ashley. I'm going to be your student nurse today. We're going to be doing an upper extremity, lower extremity, and neuromuscular examination. Is that okay?
Mm-hmm.
Okay, can you tell me your name and date of birth?
Lamb Grove, July 4th, 1996.
Okay. I'm going to check your wristband just to confirm that. Awesome. So what kind of work do you do? Is it something where it involves repetitive motions?
Yeah, well.
Okay, so do you stretch to kind of help with that pain? Okay,
Mm-hmm.
Sounds great. So looking at your upper extremity, I don't see any lesions. I don't see any bruises. You have some scratches right here and a few scars, but nothing that is notable. You have some fine hairs present. Your skin temperature is warm. The color is consistent with the rest of your body and appropriate for your ethnicity. So we're going to go ahead and move on to feeling your radial pulse. So I'm going to come right here. I want to make sure the camera can see it. I'm going to feel one right here and then the other one right here. So kind of at this groove on his wrist. And it's a 2+ bilaterally for your radial pulse. We're going to move on to your brachial, so right up here. That was a 2+ bilaterally for your brachial pulse. We're going to go ahead and move on to light touch and then sharp and dull touch. So we'll start with sharp and dull. I'm going to just kind of let you feel what sharp feels like and dull. Sharp, dull. Okay? So just close your eyes and tell me when you feel sharp and dull and where.
Okay. Sharp left shoulder. Sharp right thumb. Dull left forearm. Sharp right elbow. Dull left elbow-ish. Sharp right shoulder.
Okay, great. So the patient was able to correctly identify sharp or dull and where it was. We're going to move on to light touch. So this is what light touch feels like. And just tell me when you feel light touch, okay?
Okay.
So close your eyes.
Feel it. Feel it. Feel it. Feel it. Feel it. Feel it.
Okay, so the patient was able to correctly identify light touch. We're going to go ahead and move on to some capillary refill. So can I please have your fingers? I'm going to take one of your fingers and I'm going to press it down until the nail bed turns white, and then I'm going to release, and I'm expecting to see the color return within 3 seconds, okay? Great. 2, 3. Okay, the color returned within 3 seconds. The capillary refill looks great. Now we're going to go ahead and move on to some range of motion. So we're going to start with your shoulder. So I'm going to have you, let me see what would be a good position for you. So we're going to go right there would work. So I'll do it with you. Just kind of watch me do it. So we're going to do right here, up, forward flexion, back to hyperextension. We're going to do some internal rotation, external rotation. Great. And then I'll kind of get out of your way for this one, but we're going to have you bring your arms up, do abduction, and then bring them back. Abduction. Okay, awesome. Looks great. So now we're just going to do, so range of motion for your shoulder. Movement was fluid, and you didn't have any discomfort when you were doing it? Okay, great. So 5 out of 5. Bilaterally, movement was fluid for your shoulder range of motion. We're going to move on to your arms. So we're going to have you do some pronation. So that means palms to the ground, supination, palms to the sky, and then stretch your arms all the way out, extension, and then flexion, back in. Okay, and no discomfort or anything like that. Okay, I didn't hear any crepitus, so movement was fluid and complete. Range of motion 5 out of 5. Now we're going to move on to range of motion of the fingers. So we're going to go up to the sky, extension, down. Okay, now we're going to go ulnar deviation, out like this, radial deviation, and then we're going to have you spread your fingers, make fist, and then touch your fingers like this. back and forth. Okay, no discomfort, tenderness. Okay. Range of movement was fluid and complete. Range of motion 5 out of 5. Now we're going to test your muscle strength. So what we're going to do is go like this, and then I'm going to have you push against me, and then pull me towards. Yes, good job. Okay, now I'm going to have your fingers, and you're just going to. You're going to squeeze my fingers. Okay, great. His muscle strength was a 5 out of 5 bilaterally. Range of motion was fluid, complete. Everything looked awesome. Move on to your lower extremities now. So, how much sun exposure do you think you get a day?
4 hours.
Okay, great. So I can't really see his. Sorry, we're moving the camera, so it's easier for you guys to see. Can you just scoot back just a little bit? You can just sit like that. So we can't really see his legs right now. He has to go somewhere, so I wasn't able to take this off. But can I raise this up just a little bit to take a look at your legs? Okay. He has some socks on. Raise this up. Okay. But from what I can see, I don't see any bruising. He has some small marks, but the skin color is consistent with the rest of his body. I don't see any lesions, bumps, masses, anything of that sort. Skin temperature is warm to touch. I'm going to have to take these off. Is that okay? So we're going to take his socks off really fast. Skin temperature is warm to touch. His toe has a little bit of discoloration, but that's it. There's toe hairs present as well, which tells me that he has good circulation to his feet and his toes. So I'm going to go ahead and feel for your tibial pulse right here. Oh, wow. Okay, so that's about a 2+ bilaterally for your tibial pulse. We're going to move on to your dorsalis pedis, which is up here. Gotta adjust to get to it. Okay, 2+ bilaterally for his dorsalis pedis. So now we're going to go ahead and let me find my. We're going to do again sharp, dull, and light touch. So this is what sharp feels like.
Okay.
This is what dull feels like. Okay, so close your eyes and tell me when you feel sharp or dull and where. Okay.
Sharp, right, leg.
Okay. I'm going to try to go. Yeah, you did a good job. I'm going to try to go through these pants.
Okay. Sharp, left thigh.
Okay.
Dull, right thigh.
Good job.
Sharp, left foot. Dull, right toe. Sharp, left ankle.
Great. Okay, so now we're going to move on to the light touch. The patient was able to correctly identify sharp and dull. So we're going to light touch. This is what light feels like. Just tell me when you feel it, okay?
Okay.
It's going to be kind of difficult. I'm going to try to go through here, but because of the clothing, it makes it a little bit difficult. But we're going to start now, okay? Close your eyes.
Feel it. 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 Feel it.
Okay, great. Now we're going to go ahead and we're going to move on to some range of motion of the hip. So for this, you can kind of lay straight. No, you can lay down. You can lay down. So I'm going to just move your knee up. If you feel any pain, discomfort, please let me know, okay? feel any pain or discomfort with that?
No.
Okay, great. Okay, no pain or discomfort?
No.
Awesome. So now, can I have you kind of scoot towards like the end of the bed a little bit? I'm gonna kind of bring this down here so we can see his feet a little bit better. You can bring them down, Landon. Yeah, perfect. A little bit more. You can kind of like sit up. Like we're gonna do some feet stuff. So you can sit up, scoot back a little. Okay. So now we're gonna do plantar flexion. So you're gonna have to point your toes down, kind of like this. Great. And then back up. And then we're gonna do inversion. So bring the soles of your feet in, point them out, like this. Great. And then flex your toes, like put them out all the way, stretch them out, and then flex them back in. Okay, awesome. Everything looks great. Good. And come back up. So sit back over here. We're gonna move this back. Here this way. So now we're gonna move on to your neuromuscular test. So, do you have a history of seizures at all? No? Okay, so I'm gonna have you stand up. And we're gonna have you okay, that's okay. It's kind of hard. Here. Okay, can you just walk to the dog bed for me? Just walk straight. Okay, can you walk back like with your heel to toe? So like, yes, great. Doing that. Okay, awesome. Thank you so much. Okay. So the patient's posture, he was erect. It was really hard with the camera angle, so I am so sorry about that. But the patient's posture, he was erect when he was walking. He wasn't swaying. His arms were moving in opposite directions with each leg. He was able to walk heel to toe without losing his balance or anything. So everything looked great there. We're going to go ahead and move on to some tests. Fun stuff. So we're going to do this thing called the finger to nose test. So you can kind of look at me. And what's going to happen is I'm going to put my finger out like this, and you're going to we're going to go like this just first, and I'm going to move it around. And then you're going to close your eyes and we're going to go like that. Okay?
Okay.
So, okay, great job. He was able to complete the finger to nose test. He was able to trace it with his finger, testing his coordination, so he did a great job. We're going to go ahead and move on to this. We're going to have you do the rapid alternating test. So what I'm going to have you do is you're going to kind of place your palms right here, and you're going to flip them back and forth as fast as you can. Okay, the patient was able to complete the rapid alternating movement smoothly and fluid. And now we're going to do one last test. It's called the Romberg's test. So what we're going to do is I will have you stand. You can follow me. I'm going to have you stand right here. Sorry, I know. You're going to stand right here. Go ahead and go like this. Have your heels kind of together. Place your feet together. Perfect. You're going to close your eyes. And for 15 seconds, just close your eyes. And I have you right here. So if you feel like you're going to fall, just let me know. Okay, awesome. You can come and sit back down. So the Romberg test was negative. He had some small swaying, but that's normal. He didn't have anything there. He was about to lose his balance, so everything looked great. Good job. We're going to do some range of motion. Lastly, finally, of your back and your spine. So we're going to have to stand up again. So we're going to try our best to get everything in the camera angle. Coming like right here. So we're gonna have an flexion. So you're gonna go down, touch your toes as far as you can. If you feel any pain, don't do it. Great, 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 good job. And then extension, hyper extension. So yep, perfect. And then we're gonna have you go this way and then to the side. Okay. Did you have any pain, discomfort?
No.
Okay, awesome. Come sit back in. The patient was able to complete all of the range of motion actions. He did it fluidly without any discomfort. Everything went great, so I would leave, wash my hands, and document my findings.